Welcome to Rise Unwind. Every week on our show, we bring you lifestyle tips, tricks, and more from all the people who know it best. And this week, we have this.
Well, for men, the Someone Trend store does a great job of combining comfort and modern style.
So Audien actually invented the first $98 hearing aid.
Pampers is the #1 choice of NICU professionals and the first brand to partner with NICUs and create a Preemie diaper. Each diaper in Pampers' Preemie collection is designed for extremely premature skin.
We really want people to know that anybody with lungs can get lung cancer, and the EGFR mutation is sometimes the reason.
Today, more than 4 million children in the U.S. lack reasonable access to care.
All of the educators, all of them, it takes an entire team to make sure that our students have what they need and what they deserve.
All that and more on Rise and Unwind. GLP-1 treatments have become one of the most talked about options in weight management, but not every version is the same. Some people are turning to compounded alternatives when insurance doesn't cover brand name prescriptions. Here to explain how that works and what to keep in mind is Dr. Angela Fitch, past president of the Obesity Medicine Association. Welcome to the show, doctor.
Thank you for having me, Amanda.
We've been hearing there may be risks with some compounded GLP-1 medications. Can you walk us through what those might be?
Well, yes, the compounded versions of these GLP-1 medications are not the same as the FDA-approved versions, and that's what consumers and patients need to realize. You may not be getting the same thing. You are not getting the same thing, in fact. And these versions are not regulated by the FDA. And so it's important for people to understand that, as we've noticed 2 times the amount of risk of hospitalization in people taking compounded versions versus the FDA-approved versions. So there's a real risk to taking these medications.
And how big of a role does insurance coverage play in whether people can access these treatments?
Insurance coverage is very important because traditionally obesity was not a covered disease on insurance. And so again, because of that, it was elective for a payer or for an employer to offer coverage for obesity. And that's what we're trying to change across the nation, is that it shouldn't be elective, given it's our biggest chronic disease that we have, our largest chronic disease across the country, with over 140 million Americans needing access to care.
From your perspective, Dr. Angela, are regulators and policymakers doing enough to protect consumers? And what more could they do?
Well, we feel that regulators and policymakers could do more in that, like we saw last week, now, as of next year, Medicare will be able to cover these medications for obesity. And because Medicare didn't cover these medications, then the rest of the commercial plans said they didn't cover them either. And so because of that, there really has been a shift, and hopefully now we'll get much more coverage as prices continue to come down. So the work that's been done has been pivotal in terms of opening access to millions of Americans. We hope to see that continue, but we also hope to see further regulations put in place. There is no shortage of these medications anymore. There should not be any mass compounding at this point in time, yet there still continues to be this type of pervasive attack on consumers in terms of, deceiving them into thinking that what they're getting is the same as the FDA-approved versions.
What steps can people take to make sure they're getting safe, approved treatments?
The biggest thing you can do as a patient is talk to your doctor, right? Work with someone who is going to stick with you for the long run. Obesity is a chronic disease. It's a chronic treatable disease. There is treatment today. The treatments are getting better. The treatments are having less side effects. The treatments are really something that you can access in a manner that's safe and effective. But talk to your doctor about ways in order to do that.
Dr. Angela, finally, where can viewers go for more information or guidance?
Well, the best place to go would be the Obesity Action Coalition, which is our nonprofit arm fighting for patient rights and fighting for access for patients. It's www.obesityaction.org.
Thanks so much for the information. It's been great having you on the show, Dr. Angela.
Thank you, and you have a good rest of your day.
Ever think about how much strength it takes for the tiniest babies to fight their way into the world? November is Prematurity Awareness Month, and it's a moment to honor those little fighters and the families and caregivers who support them every step of the way. Dr. Diana Patel is a board-certified pediatrician and mom of 2, here to help us understand why caring for premature babies is so specialized that even their diapers are made with extra intention. Have a look.
Each year, more than 360 1,000 babies are born too soon, representing about 10.4% of all births nationwide. For families, it's an incredibly emotional journey. Caring for premature babies is incredibly specialized, and even something as simple as a diaper has to be completely reimagined. Pampers is behind every baby, even the tiniest fighters, which is why they created the world's tiniest diaper. Pampers Swaddlers size extra, extra small, designed to provide care and comfort for the most vulnerable babies born prematurely, weighing less than 1.1 pounds. Pampers is the #1 choice of NICU professionals and the first brand to partner with NICUs and create a Preemie diaper. Each diaper in Pampers' Preemie collection is designed for extremely premature skin and is made with premium soft materials to help prevent abrasion of babies' underdeveloped skin. For over 25 years, Pampers has partnered with March of Dimes, a national organization dedicated to improving the health of mothers and babies. This November, during Prematurity Awareness Month, Pampers is continuing its commitment to the advancement of care for the most vulnerable babies with a donation to the March of Dimes NICU Family Support Program. This program provides education, comfort, and life-changing guidance for more than 50,000 families each year as they navigate the challenges of a newborn stay in the NICU. Visit pampers.com to learn more about how you can support preemie care with a donation to March of Dimes this month.
Do you ever stop and think about all the people who make a school day work? Teachers, bus drivers, aides, cafeteria teams. It really takes everyone. This week is American Education Week, a chance to celebrate all the people supporting our public schools. We're joined by Becky Pringle, president of National Education Association, to walk us through what this week is really all about. Hi, Becky, welcome.
It's good to be with you.
So for anyone new to it, what's American Education Week and how did it start?
Well, it started in 1921, so over 100 years ago, when the National Education Association, the NEA, we partnered with the American Legion. We wanted to build support and awareness for public education because we understand that public education is the foundation of our democracy. And our focus during that week is on lifting up and celebrating, as you said, all of the educators, all of them. It takes an entire team to make sure that our students have what they need and what they deserve so that they can learn and grow and thrive.
And what themes are being highlighted this year?
Well, this year we are actually lifting up a day for our education support professionals because too often they don't get the appreciation and the love and the celebration that they deserve. So we're doing that. But we're also encouraging people to be an educator for a day. Go into a public school in your neighborhood and join in with the students in their learning. I got a chance to visit an elementary school in Arlington, Virginia. I taught, Amanda, for 31 years, 8th grade science. And so they let me go into a science classroom that partners with NASA. And it was so exciting to see the kids' hands-on learning, all of that goes on in science every day. But it also gave me the chance to listen to educators, just have them talk to me about what the issues were, what their ideas were, and how we can help them do the jobs they love.
And how can families and communities show their gratitude during AEW?
Well, a handwritten note is always nice, just a thank you. But beyond that, our educators are telling us from Kentucky to California and certainly right there in North Carolina, where I got a chance to meet with educators, they're telling us the same thing, that there are more and more gaps they have to stand in for more and more students. You know, educators spend over $500 a year out of their own pockets for materials and supplies and food. But more kids are falling into that gap, and it's important that people understand what their role can be in helping our educators meet the needs of our students. So we're asking that everyone know that our educators can't do it alone, and our kids need all the adults in the system to help them.
And so we recently had a government shutdown that lasted longer than any other Did that affect our public schools?
Well, this administration did make a decision that during the shutdown, they would not release the SNAP benefits. Those are the supplemental nutrition assistance program that feeds our kids and our families too. And right there in North Carolina, you depend on the federal government to the tune of $3 billion. Now, I want you to think about how many kids that affects and how many families that affects. But I will tell you, man, it's beyond the shutdown because that's over. But a couple of months ago, Congress passed that big, bad, terrible bill that slashed education funding, cut Medicaid, cut SNAP. So beyond the shutdown, our kids are going to be harmed. Our families are going to be hurt because of the decisions of this administration. And so we have to lift up our voices and say that's not okay. Call your member of Congress and let them know that you want them to support our public schools and our kids.
And Becky, where can people find more information or get involved?
They can go to nea.org/AEW, where they can get materials and information about American Education Week, but they can also, find out about the issues that I talked about, and they can take action because that's what our educators need. That is especially what our students need to make sure that when we say every student, we actually mean every student will succeed in this diverse and interdependent world.
Becky, I want to thank you so much for being on our show and bringing this information.
Thank you.
A lung cancer diagnosis can feel overwhelming, but stories like Debra's show how empowering it can be to ask questions, understand your options, and work closely with your care team. After her stage 4 diagnosis, she partnered with her oncologist, Dr. Azam Farooqui, to build a plan centered around her goals and her everyday life. Welcome to the show, you both.
Thank you for having us.
And Debra, how did you feel when you first heard the diagnosis? What brought you to Dr. Farooqui for guidance?
I first heard the news through another test, and I actually didn't believe it, but eventually I did. And my primary doctor got me into Ironwood, and Ironwood is where I met Dr. Farooqui.
And what helped you trust him? And how did the two of you create a treatment plan that fit your needs, your priorities, and your lifestyle?
Trust is an issue with me and everybody, but I really felt connected to Dr. Farooqui and his plan. We did, he did some testing and found out that I had a non-cell genetic marker, and he planned my treatment through that, and using Ribavent and Las Cruz, and we went from there. The treatment has been pretty good.
What does your day-to-day look like now during treatment, and what message do you hope others take from your story?
My day-to-day is I still work. I still have family commitments. I go to church. The thing I want to take away from this is that I am a non-smoker, and there is hope for those who have stage 4 cancer if the treatment is right for you. Everybody is unique, and my treatment works for me. You have to see your doctor to come up with the right treatment for yourselves.
And Dr. Farooqui, what should people know about EGFR positive NSCLC, and why is EGFR mutation testing such a vital first step?
Excellent question. And again, thank you for having us. We've partnered with Johnson & Johnson to raise awareness for the exact question you were asking. So as Debra mentioned, she's a non-smoker, and we found that the EGFR mutation is most common in non-smokers. So we really want people to know that anybody with lungs can get lung cancer, and the EGFR mutation is sometimes the reason. So what the EGFR mutation is it's basically what we call a driver mutation, which means that it's driving the cancer's growth. And so the reason why it's so important is not only do you see it in non-smokers, but these patients generally do better, and there are targeted treatment options for that mutation. So what I mean by that is if you have the EGFR mutation, we have EGFR targeted drugs that specifically go and treat that mutation. And the reason that's important is that Not only are these drugs more effective, but they're also much easier on the body. They provide a better quality of life. They have less off-target effects like chemotherapy. So we really want to make sure that we are testing all our patients and matching patients with the right treatment option that is for them.
And how does shared decision making help people manage treatment and speak up along the way? And where can viewers go to learn more?
Yeah, I think the shared decision-making piece just speaks to the fact that it's a team game in the sense that, we're all on a team, we're all battling against cancer together. And so everybody has to be comfortable and everybody has to have a voice in that battle. So we really try to make sure that we meet a patient's priorities with whatever treatment plan we're choosing, whether they want to be hyper-aggressive, whether they want to focus more on quality of life, whether they're worried about IV pokes versus, a pill. We want to make sure we're tailoring it to that specific patient. But then after we make a treatment plan moving forward, we really want to make sure that they have an open way of communicating what's going on with them so that we can address issues that may come up, like side effects. As many people know, any medication has side effects, and cancer medications are no exception. Even though these new medications are well tolerated, Rybrevant and Lescluze do have side effects, like a rash, sometimes diarrhea, sometimes swelling in the legs. But if we know about these, a lot of times they're much, much easier to manage. So when we're a shared team, it's much easier to deal with the cancer, to know that you're not alone and that you have a voice that's being heard. And so that's our biggest piece of advice and what we really wanted to raise awareness for. If patients want to learn more, they can check out rybrevant.com for more information about these drugs in particular. But more importantly, I think it's important to go back to your healthcare provider and discuss what options there are and what option is the best for your case specifically.
Dr. Farooqui and Debra, thank you so much for being here with us today.
Thank you, Amanda.
The holidays are all about connection, hearing the stories, the laughter, the moments that really matter. But for millions of people, hearing loss makes that tough. Ishan Patel, co-founder of Audien Hearing, is working to change that by making hearing solutions more affordable and more accessible for families. Ishan, thanks for being here.
Thank you so much for having me.
So why is hearing health so important during holidays like this?
For me, I first learned how important hearing health was when I was about 8 years old. I grew up close to my grandfather, and one day it felt like, does Grandpa not want to spend time with me anymore? Is he mad at me? Does he not like me? That's just how it felt. But it turns out he was suffering from hearing loss. So when you talk about hearing health, especially during the holidays, you were talking about the single most important factor of being able to connect with the people you love most, being able to hear the happy holidays, happy birthday, even I love you. Or in my case, the ability for a grandkid to have a relationship with their grandparent at all, which I think we can all agree is exactly what the holidays is about.
For sure. And what's something people often overlook about hearing loss?
People don't realize that hearing loss is one of the most important factors of your brain health. Johns Hopkins University has showed that if you have hearing loss and don't wear a hearing aid, you can increase your risk of dementia from 2 to 5 times, depending on your level of hearing loss. And another study shows that if you actually wear hearing aids, you can reduce that risk of dementia as much as 61%. So people think, Grandpa's just aging a little bit. It's fine. He can't hear as well as he used to. But no, we're talking about, first of all, the ability for me to have a relationship with Grandpa at all, which to him is the most important thing, and it certainly is to me. But 2, to protect his mind, his memory, and ultimately his life.
And how is Audien Hearing making hearing care more approachable and affordable for families?
So Audien actually invented the first $98 hearing aid. Hearing aids used to cost, on average for a prescription pair, $4,600 for a pair. Now with Audien and over-the-counter hearing aids, you can get hearing aids without a prescription, without a hearing test, shipped directly to your door in the comfort of your own home with a 45-day risk-free trial. So when you talk about making it affordable and accessible, we had to bring hearing aids that started at just $98, but also could be accessed from where people wanted it most, which oftentimes is at home.
Mm-hmm. So if someone is thinking about hearing aids this season, what would you tell them?
I would tell them, you're not alone. I remember growing up and thinking for my grandpa, what do we do? How do we help him? How do I help him? I don't know what to do. And I know he felt the same way. And the biggest message I have for those listening who might be suffering from hearing loss or might be that loved one who's just about to change their grandpa's life, their husband's life, their wife's life, or that loved one's life, I want to tell you, you're not alone. Audien exists for families just like yours, families like mine, because we didn't have that when I was growing up. And we have an in-house service team that services almost 1.5 million customers nationwide. So this isn't just about getting you the hearing aids your family needs, but it's also about giving you the lifelong service and being there right by your side for absolutely everything. Because this is a lifelong thing we do together.
And Ishan, where can people go to learn more?
For more information, you can go to audienhearing.com, AUDIEN, hearing.com. We are also available in Walgreens, Walmart, and CVS.
Well, this is a really great product and awesome to have you on the show, Ishan. Thanks for being here.
Thank you for having me.
Have you ever wished holiday outfits came with a little guidebook? With events, photos, and gifting happening all at once, it's easy to feel overwhelmed. Lifestyle expert Bethany Braun-Silva is here to share stylish, affordable ideas for the whole family, from festive looks to great giftable finds. Bethany, welcome.
Thank you so much for having me.
Good to have you. And women's holiday fashion always stands out. What styles feel both festive and comfortable this year?
Well, I love this time of year because it's all about feeling good and looking your best. And one of the things I appreciate most about Shein is how easy it is to find pieces that are not only stylish and affordable, but also made with quality materials like denim, fleece, cotton, and cashmere that look great and feel amazing to wear. And the Anusta Trend Store has elevated options that add just the right amount of sparkle, like this pearl beaded denim blouse paired with these wide-legged embellished pants from the Shein JWoww collection, perfect for channeling the iconic vibe of the Jersey Shore legend herself. It's an effortless way to dress up your day-to-day look. And for a special occasion, this burgundy organza sheared waist peplum mini dress is a beautiful option that feels classic and festive. And if you're looking for something sleek and elegant, the Musera Slinky Ruche Drape maxi dress really stands out. And for a more sporty casual look, I love the Musera Sport zip-through jacket and crossover waistband legging set. It's cozy, flattering, and perfect for travel or a casual get-together. And finally, when you want to unwind, the Shein pink fleece V-neck pajama set is soft, stylish, and a wonderful gift for anyone who loves a cozy night in.
I love a cozy night in. Family members, you've seen it. All right, so what about men? What trends are shaping their holiday looks?
Well, for men, the Someone Trend Store does a great job of combining comfort and modern style. This Harrington jacket with the contrast collar is one of my favorite pieces because it instantly pulls an outfit together. You can pair it with a wide leg tailored trouser like the one here for a more refined look, or go casual with vintage wash jeans. And to complete the look, the chunky rib knit sweater and textured rib cardigan are must-haves for layering. They're easy to wear, cozy, and make great gifts too.
And kids' outfits are always fun. What cute, giftable styles are trending for them?
Well, the Cozy Pixies Trend Store on Shein is full of adorable styles that kids will love to wear. For boys, this three-piece hoodie, vest, and pants set is perfect for layering and staying warm, while the plaid bear embroidered cardigan set is playful and festive. For girls, this red and black plaid ruffle dress is a holiday favorite, and the hooded thick fleece cardigan adds that extra cozy layer. The rib knit turtleneck set is also a great addition to any outfit because it's soft, comfortable, and perfect for layering or adding a polished touch to everyday looks.
And Bethany, us ladies know that the accessories matter. What finishing touches are must-haves this season?
Well, accessories really do complete the look, and Shein has so many great options this season. So if you want to make a statement, the Musera Trend Store square toe biker buckle boots are a standout piece. They look amazing with dresses, jeans, or leggings and instantly elevate any outfit. And for something cozy and casual, the knit beanie slouchy hat is a great way to add warmth and personality. And for gifting, the velour cosmetic bag is one of my favorites because it's soft and stylish and makes the perfect stocking stuffer.
And finally, where can everyone go to learn more?
Well, for all of these incredible, trendy holiday finds and more, visit Shein.com or download the Shein app for an easy, streamlined shopping experience. You can also search Holiday 2025 for Black Friday deals and must-haves up to 90% off.
Bethany Braun-Silva, so good to have you on the show.
Thank you so much. Happy holidays.
Do you ever feel like finding dependable childcare is becoming a full-time job? A new report shows millions of kids still lack reasonable access, and families are feeling the strain. The Goddard School says early education shouldn't be that hard to find, and they're working to expand high-quality options in communities across the country. We're joined today by Darren Harris, CEO of Goddard Systems, to talk about the need and what their schools are doing to support kids and families. Hi, Darren. Thanks for being here.
Hey, good morning.
Why is high quality childcare and early education so important for families right now?
Well, access to quality early education, it's essential. It helps children build confidence, empathy, and curiosity right from the start. And for parents, we know that it helps them balance work and family. As you said, it's hard to find. So today, more than 4 million children in the U.S. lack reasonable access to care, costing our economy substantially. And so when we invest in high quality education, we're not just supporting children, we're strengthening families, we're helping out communities and our economy.
And how is the Goddard School working to meet the growing need for reliable childcare?
Well, we're growing where families need us most, one trusted community-rooted school at a time. And today we have 14 schools in the Raleigh community. And each one of those Goddard schools is locally owned by franchisees who know and care about their communities. And so we empower our local educators and entrepreneurs to really work together to build a stronger, more reliable childcare network.
And Darren, what makes your approach to early childhood education different from others?
Well, we have an exclusive program called Wonder of Learning, and it's inquiry-based education along with the blend of play into that inquiry-based education. So we encourage curiosity from our students. It allows our teachers to guide them in a way that sparks a lifelong love of learning. So through this hands-on exploration, children get to ask questions, discover answers, and really grow academically, socially, and emotionally.
How does the Wonder of Learning program help kids grow, explore, and stay curious?
Well, Wonder of Learning is a program that turns all those why questions our children ask into discovery. So teachers guide this hands-on experience to help children think critically, solve problems, and really express themselves. And I use the example related to a teacher in a program would say, typically they would just say, they would give a kid a recipe, maybe for lemonade. And in our program, what would happen is we would say, how do you think we make lemonade? And let the children explore that and talk about it on their own. And then we may follow up that question with, well, how many lemons should we use? Or how do we make it sweeter? And so that serve and return dialogue is critical to elevating the learning experience. So we encourage that experimentation.
And so this week is Family Appreciation Week. Why is it meaningful to honor the families you serve?
Now, this year's celebration, which is taking place this week, aligns perfectly with Thanksgiving. It's a way for us to show gratitude and say thank you to the families who make our schools so special. And it's also about celebrating that partnership between parents and educators, because when families and teachers work together, children get a chance to flourish both in and beyond the classroom. And that's part of our core beliefs, is that learning doesn't just stop at our door. It's that family connection and continuing that education at home.
And where can families go if they want more information?
Well, you can visit GoddardSchool.com, and it's an area where you can explore our approach. You can find a school near you and also get expert tips for parenting. And for those also interested in opening a school in the local community, you can visit GoddardSchoolFranchise.com.
Darren, thank you so much. I want to thank you for joining me.
Thank you so much, Amanda.
Thanks for watching Rise Unwind. Please visit us on our website at RiseUnwindTV.com. Follow us on our socials and subscribe to our YouTube at Rise Unwind. And thanks for tuning in. You take care, and we'll see you next week.